Hi, this is Dr. J with Dental Masters, and we're here to talk to you about being comfortable at the dentist and 4 ways and how you should be, could be, or can be. So let's talk about number 1, dirty word, the injection. This is something that should not be that uncomfortable, and you should not feel much of it at all. For the fainters, by the way, I'm one of them. One tip is tell the dentist, or if you're getting blood drawn, to make sure that your bed is flat, that your head is at least at the level of your feet, or possibly lower, called Trendelenburg. That means your feet are higher than your head, and then you can't really pass out. But besides that, there are topical gels and ointments that are created by compounding pharmacies or dental companies that compound it. And they're super strong, so just a little bit of this ointment put on the gum tissue that needs to be injected. If you hold that there for 2 or 3 minutes, it works super effective, and you really don't feel much of anything. Maybe a tiny little pinch in some spots. So make sure that that's available, because there's some people that some dentists that will just take this cotton swab with the stuff from your, it tastes like cherry and it's not very effective. They kind of place it there for a second, take it out. I think they're doing that for themselves, unfortunately. Maybe they're not aware of the compounding products, but they're there. So find someone that has them and have them use it. It'll be a big help. Number 2 is nitrous oxide, or laughing gas. So for any of you people that may have in the dental office, nitrous oxide, it's a very safe way that it's almost 100% safe unless you've taken some other drug or alcohol. But given at safe levels, it puts you in a trance or a state of alternate perception, or possibly reduced anxiety. And there's even some thing called analgesic properties, which means that it has some pain relieving properties, which also helps, by the way, with the injection. And if you want to add another piece to that, is get some headphones, possibly some noise canceling headphones, and listen to your favorite music or your favorite book or podcast. I have a patient, John, he says, give me some headphones and some Jimmy Page and some nitrous, and you can get through any dental procedure. And John, I know you can, because you have. So that's number 2. Number 3 is IV conscious sedation. We do this here at Dental Masters. I think about 5% of general dentists do IV conscious sedation. So this is where medication is administered, typically through an IV, and it will make you sleepy, make you relaxed, and most importantly, they give you amnesia properties, so you can't really remember what's happening. However, it's safe in the fact that you're maintaining your gag, swallow reflex, you're breathing on your own. And so there's very little memory during this type of sedation. It doesn't work for everybody. Some people that have a higher tolerance because maybe they take a prescription medication that's necessary. Some people that drink a lot of alcohol, or possibly if you smoke a lot. IV conscious sedation doesn't always work as well for that. So then we need to go to the next level. And the next level is bringing out, when we do offer this here, a board certified anesthesiologist, and it's general anesthesia. So this is where they will give you medications that do put you fully to sleep. They are monitoring your breathing, your airway, your blood pressure. And we're doing that during IV, but they are really controlling that. Very often they'll put a tube to make sure that your airway stays open, and so you have to be the right candidate for it. You're screened, and again, I only am doing this with a board certified anesthesiologist. Why would you do this? Again, if you're not a candidate for the IV because it doesn't work, if you have such a high fear level that we just can't bypass it and you need heavier medications, and that's possible. There is serious phobias and fears that the traditional IV sedation, conscious sedation, doesn't work. You want to get a whole lot of work done in a short period of time. And the last part is for some of the more major procedures, maybe where we're doing bone grafting, where we have to rebuild the bone, or we might be placing multiple implants to give you your full smile back with an implant supported smile, so you can chew and eat smile again. some of those procedures are just a lot more invasive, and I've done them with local anesthesia, believe it or not, more often with IV sedation and also with the general anesthesias, with the anesthesiologist. So those are 4 ways that you should be able to get comfortable for the procedures. Why am I telling you this? Because if you're at home and you have dental issues and you can't smile, you're hiding your smile, you can't chew, you're in pain, and these things are really holding you back to go to the next step in your life. I've seen so many people change with these procedures where they were in pain, or emotional pain because they couldn't smile and they were embarrassed, or a physical pain because the teeth hurt and they couldn't eat, and that caused other health issues, where we've really transformed people's lives. And I'll show some more cases in future videos. But find a dentist who does these things, talk to them, and find out what is the best way to get through the treatment that you have in the most comfortable way possible. Hopefully you enjoyed the information that we have provided, and there's more to come. This is Dr. J at Dental Masters. If you like what you heard, hit the like or subscribe button, and we'll see you in the future.